Hi everybody, this is Michael Isaac. I'm a public health physician with Indigenous Services Canada. Thanks very much for the opportunity to speak with you today about COVID. Specifically, I've been asked to speak about COVID isolation periods. COVID cases can transmit virus to other people for up to 10 days after their symptoms start or after their test date. This is why we ask COVID cases to isolate for 10 days. Contacts of a COVID case can have COVID grow in their body for up to 14 days after their last exposure to a COVID case. Most people will develop symptoms of COVID after an exposure by day 10. This is why we ask contacts of COVID cases to isolate for 10 days, but then to self-monitor and wear a mask for a further 4 days to complete a total of 14 days of isolation and self-monitoring. If you are a case and you're living in a household with other contacts, we still require you to isolate for 10 days from others outside of your home. If you're a contact living in a household with other cases, we're advising you to isolate for 10 days past the time when the COVID case in your household would be deemed recovered. So they would be deemed recovered after day 10 of their isolation period, which would mean that as a contact, you need to isolate for a further 10 days to prevent you from potentially growing COVID in your body and transmitting it to other people. If you're a contact who's living in a house with some other cases and you become a case yourself, if you test positive, then we would ask you to do a 10-day isolation period from the time when your symptoms started so that you don't pass COVID on to others outside of your household. Thank you very much for having me and looking forward to doing this again.